Well, thank you, Chip, and good morning. It's great to be here at PTC Therapeutics, which is a tremendous company doing incredible work, the very type of work that I envisioned when I authored the therapeutic tax credit and that I knew was existing in New Jersey, which was my main focus, but certainly across the country. So I'm pleased to be here to announce a $53 million federal investment in New Jersey's biotech firms. Let me thank Chip, who is the CFO here, for his gracious welcome, as well as to your president and CEO, Stuart Peltz, and the senior management at PTC and the members of the board of directors for having us here, and Debbie Hart, who is the president of BIO, which is the trade organization of the biotech industry here in New Jersey, and she is just a tremendous advocate when we were in the midst of trying to make the tax credit a reality. It's a $1 billion tax credit in the midst of the healthcare reform debate. It had several lives. It was on the table, it was off the table, it was back on the table, it was like Lazarus a few times. And so, but it finally sustained itself, and Debbie and her organization, as well as the national organization, were very much engaged. So I appreciate their advocacy. On November 3rd, the Department of Treasury of the United States and the Department of Health and Human Services announced a list of organizations nationwide that were awarded a total of $1 billion in tax credits and loans, and PTC Therapeutics was one of them, and for very good reason. The pioneering research and development that's being done here, and Chip mentioned a whole host of them, but in projects like the use of small molecules to treat spinal muscular atrophy, and small molecule antiviral agents against hepatitis C, which of course creates, among other things, cirrhosis of the liver and liver cancer, is cutting-edge science that we must support to keep America in the vanguard of discovery and create the 21st century jobs we need. I'm excited to see this program that I authored rewards New Jersey ingenuity and entrepreneurial spirit like that which we see here at PTC and throughout the state. These credits and loans are for the development of new, innovative biotech projects that will spur innovation here at PTC and at the 132 New Jersey companies that are being awarded nearly $53 million in grants and tax credits for their groundbreaking research efforts. We have good reason to be proud of our biotech companies and the creativity and innovation that has always been part of our history here in New Jersey, the proud home of Thomas Edison. These tax credits are for up to 50% of a company's investments in qualified therapeutic discovery projects that will lower healthcare costs, save lives, and also put people to work in the jobs of the future. And they will help New Jersey remain an epicenter of American biotech companies and research. It was clear to me in the process of passing the therapeutic discovery tax credit in the Senate that small companies hold so much promise for our healthcare system, for saving and enhancing lives, and for our economy in general. It was equally clear to me that many of them could not survive in an environment where private capital had simply become unavailable. So I thought that it would be critically important to, in essence, create a bridge to the future, to a time and place in which that type of private capital would once again flow into biotech companies such as PTC. And I thought that if our risk-adverse capital markets would not fund cutting-edge science, we would be at risk of losing high-wage, high-quality, highly desirable jobs in research to countries like India and China. It was clear to me that sustaining the advancement of promising new therapies, maintaining high-wage American jobs in a competitive global industry, better managing the cost of disease through more effective treatment and diagnosis, and advancing the goal of finding a cure for cancer in our lifetime is clearly an investment in our collective future. The fact is that the Therapeutic Discovery Project tax credit is, in my view, a necessary investment if we are going to continue to lead the world, if we are going to make this century another great American century. It will create 21st century jobs. It will save lives. It will keep New Jersey in the vanguard of research, innovation, and scientific discovery. And maybe someday, it will help a young New Jersey scientist find a cure for cancer in our lifetime, or a cure for the devastation of Alzheimer's that took my mother's life a year ago. Imagine if one day we can look back and say that we helped a small company with a grand idea discover the undiscoverable. Imagine that one discovery could save millions of lives. To me, that's what this initiative will always be about. It will be a symbol of hope, a symbol of American discovery, a tribute to our pioneering spirit in New Jersey and across the nation, a shining power of American ingenuity to move the world. That's the big picture, the 30,000-foot view, so to speak. But there's a practical side to this as well. As healthcare costs in the United States continue to rise, we know that one of our major efforts in our reform was to control costs across the board. And we know that new medical breakthroughs will play a critical role in reducing healthcare costs and improving patients' quality of life. We also know that 2/3 of the increase in healthcare spending over the last 2 decades is because of the increased prevalence of chronic diseases. So it stands to reason that emerging biotech companies can create the path forward. They can improve access to quality healthcare and reduce costs to patients and our overall healthcare system. That, to me, is a win-win-win in my book, and in the process, it also creates 45,000 high-paying jobs nationwide. Helping them means building a 21st century economy. It means remaining the strongest, most innovative nation in the world, spurring the next generation of technology and research. It means investing in our nation's intellectual infrastructure, in the next generation of researchers, scientists, technicians, and entrepreneurial small business talent. In essence, it means investing in America. Einstein said that the process of scientific discovery is, in effect, a continual flight from wonder. Each of these young firms is in the process of new scientific discovery that will answer questions we may not even have thought of yet. I'm proud to have played a part in the process as a member of the Senate Finance Committee, proud to have created the federal program that I hope will give many of the firms who stand to benefit from this program an added ability to make those unimaginable discoveries that will change the world. I already know that Debbie has talked about an extension of the credit. It's never like what you did for me today. It's, so we are, but we understand the importance of it. We'll have to see. We're going to face some challenges as we deal with the budget, but I certainly hope that this initiative can enjoy the bipartisan efforts that are at the core of making America more competitive. And if we can do that, then we may very well have an extension of the credit, something I certainly want to be an advocate for in the United States Senate and as a member of the Senate Finance Committee. Yes?
Senator, I wondered if you could talk generally about the Affordable Care Act. All this talk about being amended, revised, repealed, or whatever. What's sort of the outlook in your view?
Well, I think that there are those who suggest they want to do that, maybe for their own political reasons. The question is, do we want to repeal the therapeutic tax credit? That's part of the act. Do we want to repeal closing the donut hole for senior citizens in our state who find themselves very often, because of high prescription drug costs, falling in that gap that exists in the law right now in prescription coverage? I know in my mom's own case, it wasn't for my sister and I, when she fell in that gap, the access to life-saving, life-enhancing drugs for a period of her life would not have been real. And so I know that closing that gap is important to millions of seniors. Do we want to repeal that? Do we want to repeal that a woman, just simply because she is a woman, gets rated by insurance agencies at higher rates than a man? Do we want to repeal that no longer can pregnancy be a pre-existing condition? Do we want to repeal that someone who has a heart attack on the job and therefore couldn't get insurance now has access to a high-risk pool that I helped create here in New Jersey working with our governor? do we want to repeal the cost control measures and the pay for performance that the legislation includes? And I could go on and on. So when we talk about repeal, the question is, what is it that we want to repeal? Do we want to repeal that if you have a child up to age 26, you can keep them on your insurance now? I mean, I don't know what we want to repeal, especially when not only is the legislation totally paid for, and the Congressional Budget Office, the nonpartisan division that ultimately scores for Democrats or Republicans, legislation says this reduces the overall debt by well over $1 billion. So I'm looking forward to see what parts of this individuals want to repeal.
Can I ask you just about one provision? I know that small businesses are upset about having to send the 1099s for every 6 months.
And that will be repealed.
That will be.
That will be repealed.
Okay.
You know, in the history of our country, if you ever looked at major reforms, Social Security, Medicare, they were over time perfected so that the legislation that was introduced is not, and that ultimately got signed into law, is not the programs that we know today. They were perfected over time. And one of the reasons that the legislation has a longer implementation period, because when you are taking the size of an overall healthcare system in our country, you are going to want to have the time to implement it and have the oversight that the Senate Finance Committee and the Senate Health Committee will conduct over the next 2 years to make sure that we perfect this as well as possible as we find unintended consequences or shortfalls that ultimately we can enhance. So I'd rather perfect something that control costs, takes away all of these barriers that existed to health insurance, brings, in the greatest country in the world, millions of people, including 1.5 million New Jerseyans who have no insurance whatsoever, finally an opportunity to get coverage in a private market, not a government market, in a private market, to take away the discrimination of pre-existing conditions and all of those that I mentioned. I seek to perfect that versus just simply to repeal it. If we repeal it, we go back to double-digit premium increases that existed before the law was passed, in which insurance companies were raising premiums by anywhere between 15 and 20%, whether that's for a company, and that means a lot of their ultimate budget goes towards keeping insurance for their employees. More and more of it is being eaten. Less and less of it goes to salaries if you're having that much that you're putting into insurance. For families who didn't get insurance at work and paid for it, huge burden. I mean, I don't know what people want to repeal, but I look forward to hearing which parts of it they want to repeal. Yeah.
Senator, can New Jersey biotechs apply for this tax credit now, and how long will the credit last?
Well, the credit has already been awarded, and as I said, we had well over 100 New Jersey companies that are getting the amount of money that's listed on the check. And the question is whether we extend the credit so that future opportunities will continue to exist as we bridge the private marketplace and the investment that we'd like to see that marketplace come back to, which I think it will. But in the interim, we want to keep these companies alive. We want to keep them as prosperous as possible. We want to keep their research as robust as possible. And that's why the credit was created in the first place. Anyone else? If not, again, thank you very much. I look forward to the tour. Yeah.